What if the biggest mistake in modern medicine is when we intervene? Not how we treat disease, not which drugs we prescribe, but the moment the system finally pays attention. By the time most illnesses are diagnosed, the trajectory has already been unfolding for years, sometimes decades. We built a health system that waits for the crash. But what if medicine could see the arc of health earlier and change where it leads? That idea has a name: trajectory engineering. Most people think healthcare begins when something goes wrong: a diagnosis, a trip to the emergency room, a surgery that suddenly becomes necessary. That moment, the crisis, is when the system activates. And when it does, modern medicine can be extraordinary. We can transplant organs, replace joints, reopen blocked arteries, and treat diseases that once should have been fatal. But there is a quiet truth beneath all of this. Health rarely fails in a moment. Long before a heart attack, blood pressure has been rising. Years before diabetes appears, metabolism has been shifting. Decades before dementia is diagnosed, the brain has already begun to change. Health is not an event. Health is a trajectory. For more than a century, our healthcare system has been built around rescue, responding to the moment when disease finally declares itself. But what if we designed a system around the trajectory instead of the crisis? That idea is called trajectory engineering. Trajectory engineering is the Rosetta Stone for the next generation of health systems. It means learning to see the arc of health earlier, understand where it is heading, and intervene before damage becomes irreversible. To make that possible, a new architecture is emerging. At its foundation is the health principle, the individual whose life and future are at stake. Supporting the health principle is the human health ally, clinicians and professionals who bring judgment, empathy, and accountability. And alongside them is Dr. AI, an analytic intelligence capable of detecting patterns and risks across millions of lives that no single human could see. Dr. AI understands you in every variation of what that means. Together, they form what is called the triangle of trust. At the center sits something even more fundamental: personal health culture. This is what Dr. AI brings uniquely to this table: a summary of the values, habits, and decisions that shape health across the arc of a life. This architecture forms the foundation of Health 4.0, a system not designed only to rescue people from disease, but to help shape healthier trajectories over decades. In this series, we're going to explore how that system works and why it may define the future of medicine. But everything begins with a simple realization: health is not an event. It is a trajectory. Episode 1, The Rosetta Stone. If health is a trajectory, then the question becomes simple. Why do we begin to see that trajectory clearly enough to change it? How do we do that? For most of the history of medicine, that simply wasn't possible. The tools weren't there. Data was fragmented. Signals were invisible. A physician might see a patient a few times a year, sometimes less. The health system was designed around those encounters. So the system evolved to focus on the moment when disease finally became undeniable. That is the world of rescue medicine. And to be clear, rescue medicine remains one of the great achievements of modern science. Trauma care, intensive care, cancer therapies, organ transplantation, these are extraordinary capabilities. But they are capabilities that activate late. Trajectory engineering asks a different question. What becomes possible when we begin to see the trajectory before the crisis? The signals are there: changes in metabolism, patterns in sleep and activity, subtle physiologic shifts, environmental exposures, behavior patterns that accumulate over time. For the first time in history, we have the capacity to bring those signals together and understand what they mean, not as isolated data points, but as a living picture of health unfolding over time. That is the beginning of a new architecture. Over the next several weeks on this podcast, we're going to unpack the components of that architecture. The first is the concept of the health principle. For decades, we have described people within the health system as patients or consumers. Both of those words place the individual in a reactive position, someone receiving care or purchasing services. The idea of the health principle is different. In any complex system, the principal is the person whose interests the system is meant to serve. The health principle is the individual whose life trajectory is at stake. Health decisions ultimately belong there. The second component is the role of the human health ally. Medicine has always depended on human judgment, on clinicians capable of interpreting complex situations, weighing trade-offs, and supporting individuals through difficult decisions. Technology does not eliminate that role. If anything, it makes it more important. Empathy, accountability, and judgment remain human responsibilities. The third component is Dr. AI. As health becomes more data-rich and more complex, we need analytic systems capable of seeing patterns across enormous numbers of individuals and signals. No human being can track millions of trajectories simultaneously. Dr. AI represents the analytic layer that helps identify risks earlier, highlight meaningful patterns, and support both the health principle and the human ally in making better decisions. Dr. AI translates you into the system. So the responses that come back are not random or based on average human, they're based on you. When these three forces come together, they form what we call the triangle of trust. At one point of the triangle is the health principle, holding autonomy and values. At another point is the human health ally, bringing professional judgment and accountability. At the third point is Dr. AI, providing insight at scale. But the center of this triangle is not technology or institutions. It is personal health culture, the lived habits, beliefs, and decisions that shape health every day across the arc of a life. Trust in healthcare has always depended on alignment between these forces. When empathy supports autonomy, when data supports judgment, and when authority is matched with accountability, trust forms. And trust is what makes systems work in health. When we step back and look at the system through this lens, something else becomes visible. We are not simply talking about a set of technologies or a set of reforms. We are talking about a new operating system for health. We call this system Health 4.0. Health 1.0 was the end of infectious disease and the beginning of public health. Health 2.0 was the rise of hospitals, specialists, and modern medical science. Health 3.0 brought digital records, advanced therapeutics, and large-scale health systems. Health 4.0 begins when we organize care around trajectories rather than events, when individuals hold meaningful agency over their health journey, when clinicians are supported by intelligent systems capable of seeing patterns earlier than ever before, and when trust becomes a structural feature of the system, not an afterthought. Over the coming weeks, we're going to explore each of these ideas in depth. We'll talk about trajectory engineering and how it changes the economics of health care. We'll examine the concept of the health principle and why agency matters more than ever in the age of intelligent systems. We'll explore how Dr. AI works and what it means to build analytic systems that support rather than replace human judgment. We'll look closely at the triangle of trust and why governance and culture are essential in AI-enabled medicine. And we'll unpack the architecture of Health 4.0 itself. This conversation is not just about technology. It's about the future structure of health systems and the role each of us plays within them. Because if health is a trajectory, then the most important question is not simply how we treat disease. It is how we shape the arc of a life. If there is one idea to carry forward from today, it is this. Health is not something that suddenly fails in a moment. It is something that unfolds across a lifetime. For generations, medicine has been organized around rescue, around the moment when disease finally becomes impossible to ignore. And when that moment comes, modern medicine can do extraordinary things. But the future of health will not be defined by how well we rescue people. It will be defined by how well we understand and shape the trajectory long before the crisis arrives. Over the next 5 weeks, we're going to explore how that future works. We'll talk about the health principle and why individual agency must sit at the center of the system. We'll explore Dr. AI and the role of intelligence at scale. We'll unpack the triangle of trust and the governance structures that make technology worthy of confidence. And we'll look closely at the architecture of Health 4.0, the operating system for the next generation of health systems. These ideas come together in my new book, Dr. AI, Reimagining Health, which launches April 7th. If you're interested in the future of medicine, the future of AI, or the future of how we live healthier across decades, I hope you'll join us for the conversations ahead. Because once we understand health as a trajectory, everything begins to change. Thank you for listening. Until next time, remember, health isn't an event, it's a trajectory. And I'll see you next week.